Hello, it's Kiana Bradley again. I will be doing a few clips. Forgive me, I'm out of breath. Okay. Sorry, I may cut that out later. I'm going to be doing a few clips about just who I am, why I started KB Calls. This one will be about the evolution of KB Calls. So, and then there's a bunch of other ones, like where I'm working. I work in 3 different spaces: my bedroom, my in-laws hallway. That's where I get a lot of my work done, is like my in-laws hallway and the bedroom. And then I have a space at WeWork. So maybe once or twice a week I'll go there, depending on if I'm meeting clients or whatever I'm doing, if I need to get out of the house and concentrate. So here we go. Evolution of KB Calls. So KB Calls, Caring Advocacy and Liaison Services, Kiana Brathwaite, was founded in November 2016, and it's gone through different evolutionary cycles since the founding. Initially, because of my nursing background, when I would talk to people about what I was doing, they'd be like, "Oh, you're a nurse navigator, a standalone." And I was like, okay, sure. Nurse navigator makes sense, right? But then there's more to it than navigation, right? There's understanding, there's relationship building, there's a whole lot of different things. So I was like, all right, well, that doesn't really fall into what this is. So then it became healthcare roadmap specialist, right? And I was, oh, great, wonderful title, great name, fell off the tongue like nobody's business. And I was like, when I would say it, people were like, okay, what does that mean? How? I don't even know what you do, and it didn't talk to the nursing background that I have. So then it became healthcare interaction services, right? Because even though we use the healthcare system, we don't necessarily interact with it. So that's something that I really want to do, is like talk to people about interacting with it, participating in it, really using it, getting into it, because I'm all excited, rah, system, blah. And now it's more of a resource in healthcare, right? Because it allows me to use my nursing skill set, the listening piece, the compassionate piece, the relationship building piece, but then also to be a resource, right? Because I've found, as I've worked with clients and doing deep dive stuff, all aspects of your life affect how you experience your interaction, and then, how you really interact with it. Recently had clients who the head of household they're still with us, a business owner, and they weren't sure how to separate out their revenue from the business to what their actual take home was, so that from a federal standpoint, they can say, okay, this is what our earnings are, this is what our income is, and then use that to help them figure out what their insurance needs were, and how they were going to pay for those insurance needs. And so there was like this, I had to go into the IRS.gov and pull in my specialist, my little side, my secret ingredient resource, and just ask him to help out, and go into the tax forms and say, okay, what's on line 22? All right, let's separate, let's subtract that from this. And then what do you have on your PA state tax form or your New York state tax form that said, in this line? And so as a resource, right, it just doesn't pigeonhole me to healthcare, because you need your health to be able to do all the other things that you want to do in life. And you need to understand how that affects your decision making. So I really like resource in healthcare. I think that's kind of where I'm going to stick with, because it covers everything, and it's not just nursing, it's research, it's pulling people together. It's, hey, you need help to figure this out before we could do this, before we could do this, before we could do that. So that's where the resource piece comes in. So that's the evolution. And I'm going to end this clip. The who I am, the where I work, all that good stuff will be in other clips that you'll be able to take a look at. And anytime you want to refer back or ask questions, shoot me an email, and all that information will be in the descriptions. Okay? All right, well, great talking to you, and take care.